Okay, so this PowerPoint, we are going to talk introduction of medication calculation for our student, okay, NCLEX student. So this PowerPoint basically contained some formulas. The first PowerPoint, we discuss basic information, what we need to know before calculation. But this PowerPoint help us to calculate some mathematical problem. I show you some question and what are the objectives in interaction for today to gain an understanding of formulas used to calculate the correct medication for administration. This is the objectives for today's. And also, here is some example of medication formula, how to use or application of them. Also, some practice question throughout this presentation and what is need for the test. Here, this is the some example question, board question like this. If you get any mathematical question like this, I'm just going to read it first. Then we go for the solution of solution of this question. Question number one: a patient is ordered an injection of 10 milligram of pethidine. Each stroke ampoule is 100 milligram per ml. How much you have to draw? So first of all, the two pictures here. This is called vial. Okay, vial contain the powder form, and this one is called ampoule. Ampoule is a volume or liquid, but this liquid contained the medication. Maybe you can say this is the water, and water dissolve the solute, which is medication. I like to give this example: coffee. One glass of coffee, it is how we make the coffee: water with some coffee mat and milk. So water, not the coffee does not only the water, they contain water with some solute. What is this solute? Coffee or coffee mat. So this solution, not only the distilled water, they contain some medication, what is called solute, right? So like this, 10 milligram per ml. So in 1 ml solution, 10 milligram solute means 10 milligram lidocaine. So this is the medication called procaine, right? So out of 100 ml, 1 gram procaine. So this is the ampoule. Ampoule contain liquid, but inside the liquid there are some solute. Solute means solid one, like sugar in a mixture, coffee in a coffee solution. Same thing is here. So in the first question, they said 80 milligram pethidine doctor prescribed, but the medication in your hand is 100 milligram in 1 ml. So the formula, it is called medication formula for liquid. It is equal to total to the amount of medication administered equal to the doctor's orders divided by the medication in your hand multiply volume. So AD divided by 100 multiplied by 1 ml. This is the amount we have to know. We have to calculate for the patient, right? So here, the formula, it is this formula, okay? So medication formula, when is volume or injectable. So the number volume equal to, total medication I need to admit to the patient equal to the strength is required, means doctor prescription or medication or prescribed medication divided by stroke strength, means the medication in your hand, your RN in your hand, pharmacy gave you. Like I have a fever, doctor gave me 800 Tylenol, but you have 500 tablet in your hand, right? So total amount, prescribed amount divided by medication in your hand. This is the number of the tablet. But when we go for the injectable form, volume should become. So prescription medication divided by strength multiplied by volumes. So in that question, 80 milligram pethidine divided by 100 milligram pethidine in your hand or stroke divided and multiplied by 1 ml. This is the volume. So when you go through like this, we can count down to the medication we have to admit to the patient. So this is the one kind of formula I said. So if we go like this one, you can try right now. AD, AD divided by 100, how much? 80 divided by 100 multiply 1 ml, 8.0.8, 0.8. So first one is 0.8 ml. So what about the second question? A patient is prescribed 3 grams of sulfazidine, and the stroke contain 600 milligram per ml. So how much sulfazidine should be given to the patient? So always I say that conversion is the first steps of calculate the medication. Conversion, right? So this is the gram, big unit, and medication in your hand is 600 milligram, small unit. So this 3 gram have to convert it to milligram. So 3 gram converted to milligram, this is the prescription medication. So 1 gram equal to 1000 milligram. So 3 gram equal to 3000 milligram. So 3000 divided by 600. So 3000 divided by 600, how much? 5. This 5 multiply by the 5, because 5 is the volume, right? So it is 25. How much sulfazidine should be given to the patient? 25 milligram. So I said conversion is first steps. Always we have to, when we have to calculate, all of the numbers should be same unit. One is the gram and the milligram. So gram has to convert to milligram. So 3 into 1000, I mean 3000 is a prescribed medication, but the medication in your hand is 600 milligram in 5 ml solution liquid. So again the same formula what we used few minutes ago. The formula we use here, volume formula. Volume equal to number of the strength. It is 3000 medication in your hand, 600 multiply 5 ml. Okay, so when you go through like this, it is 25 ml. 25 ml. So go next one. A patient is prescribed 1 liter of saline solution. 1 liter. Liter is a big. You have to convert to the small milliliter. 1 liter equal to 1000 milliliter. So doctor prescribed 1000 milliliter because you know that 1 liter equal to 1000 milliliter. The flow rate, the flow rate equal to volume divided by time. So flow rate is set at 100 ml per hour. Flow rate is mentioning how long you have to infusion. So this is little bit defined. We know the formula is called flow rate. I mean flow rate equal to volume divided by hour, I mean time, right? So now if I want to find out the how long, they ask about the time, how we have to find out? It should be time equal to volume divided by flow rate. Is little bit mathematics. So volume is 1000 divided by 100 because they talk about the flow rate 100 ml. Answer is 10 hour. So I can show you the example. So how we have to find out 10 hour. So this is called volume formula. Okay, so here flow rate, basically flow rate formula. So flow rate, okay, this is the flow rate formula. Flow rate equal to volume per time. So this is a 3 number. If NCLEX would give any 2 number, you can find out other 3. So in that question, they said flow rate is there, volume is there, you have to find out the time. So just put down the flow rate is 100, volume is 1000. How much time? So just cross it. Time should be go there, flow rate come here, volume divided by the flow rate, and you can find out the flow, I mean time, to find out the flow rate. Here is the more explanation we are coming, but let me finish the another 2 question. How many 300 milligram tablet are required for prescribed dose 450? So prescription medication is 450 and 300 in your hand. So the number of the tablet equal to prescription medication 450 divided by medication in your hand 1.5. The medication and prescription. Last question here, the doctor ordered penicillin via potassium oral suspension. It is 56 milligram per kg per day in the 4 doses per day for a child whose body weight is 25 kg. The suspension available 125 milligram per ml. What volume should be administered for each a dose? First of all, there are too many information, right? Potassium oral suspension, 55 milligram per kg per day. So if your patient is 1 kilogram, they're supposed to get 56 milligram. But here is mentioned your baby is 25 milligram. So how much your baby has to get? The 56 multiply 25 means 1400. So you have to understand 56 milligram per kg per day. So if your baby or you is 1 kilogram, it is 56 milligram, but our body weight definitely not 1 kilogram. Like you are 75 kg, I am 72 kg, another person 100 kg. So according to the body weight, it should be changed the number. So my patient is a 25 milligram. 25 milligram multiply 56. So this is the total amount your patient need. The suspension available. So this is the total number 1400 we need prescription medication, and available is 125, and volume is 5, right? So total prescription medication divided by medication in our hand multiply the volume. So they said what volume should be admission at each doses, right? So this is the total 4 doses. 4 doses. This is total. So this, if you divided by 4, you should get the number 350, because the 4 are in the 4 doses in the question, but they want each doses, right? So you have to find out the 4 is total number, but you have to divide it by the 4, and you are supposed to get the single dose. So also we have a formula for this 350. So we're going to formula one by one. First formula is called medication formulas. Medication formula is called number of the tablet. So number of the tablet equal to prescription requirement or strength required for the patient divided by the medication in your hand, or what are the medication stock. So if you divide it into the number of the tablet, like doctor prescription is 800, the medication in your hand is 400. So you need 2 tablets, just using this formula. Second one, here is the example. 750 milligrams ciprofloxacin is ordered on hand. And on hand are 500 tablet. How many tablet you need? So number of the tablet equal to strength stroke hand. 750 is the prescribed, and 500 you have. So 1.5 milligram, 1.5 tablet, 1.5. Second formula. So how many milligram tablet of codeine are required for a dose this gram, right? So you see how many 200 tablet codeine are required for the dose. So medication in your hand is 20 milligram, and prescription medication, it is this one, 0.05 gram. Gram is a bigger unit, but we have to convert the gram equal to milligram. So when the big unit convert to small unit, we have to multiply. 1 gram equal to 1000 milligram. So 0.05 gram multiply 1000. It is 50 milligram. So this is the 50 milligram is prescribed medication or medication dose we need. But the medication in hand is 20 milligram. Divided 50 by 20, 2.5 tablet, 2.5 we need for the patient. And here another formula is called medication formula in injection or volume. So what are the volume required? Means intramuscular or IV injection form. So formula said strength required divided by the strength in hand multiplied by the volume in the ampoule. Support a question you can get in the exam need to use this formula. When you use this formula, if they ask you to calculate the intramuscular or intravenous or liquid, support in the exam, they have a strength, they have a stroke, but they do not mention the volume. You have to write it 1. You should write it here 1 and calculate the formula. You will get the answer. There are no confusion with a 100% confident if God will. Okay. So here is called medication formulas for volume or injection. Injection may be all IV or IM, even sub-Q. Okay, for all. And go next here. Example, volume medication. Calculate the volume to be drained up if a patient require 1 milligram bumetanide, and each stroke ampoule contain 2 milligram volume. So 2 milligram medication in your hand, 4 ml means volume, and 1 milligram is doctor order. So you see in the different way to find out what for what. Like milliliter, this is the unit for liquid or volume. Milligram, this is the unit for solute. So doctor order 1 milligram divided by 2 milligram I have, and volume is 4 ml. So answer is the 2 ml. Volume formula I said. And next one, another another example showing here. An infant require 2000 unit of calciprine if the stroke ampoule contain 2000 unit in 1 ml. 1 ml means volume. How much should the draw? Volume formula said strength 2000, but this 20,000, this that 20,000 in 1 ml. So how much we have to need for this patient, right? So here they said strength, stroke, multiply the volume, 2000 divided by 20,000 and 1 ml. It is 0.1 milliliter I need for my patient. Another formula, also it is the volume, but different example I left here for student, because you do not know what question you will get in NCLEX board. This is the reason I left some of the example here. Volume medication example. So if an adult patient was ordered 85 milligram of cortisone, means the steroid, 85 milligram, and each stroke ampoule was 5 ml. Ampoule, I will show you the picture. What is ampoule? 5 ml and contained 100 milligram of volume. You see, same talk, different way explained. So prescription is 85 milligram and the ampoule contain 100 milligram cortisone in 5 ml water. So 5 ml is a volume. Example, you do not know what for what, but you know the formula. Then find out what for what. Milligram means it is a solute, milligram solute, milliliter liquid. This is the unit we use. So only see the unit, you have to put it in this formula. So volume, milliliter, 5 should be go here. Doctor order should be go strength you require for the disease. And 100 milligram, the medication in your hand, you have to put the patient, give the patient, right? So here, we said it is 4.25 milliliter. And go next, another example we left, also same but different way to explain. A patient is ordered 70 milligram of pethidine and find the volume required if the stroke solution contain 10 gram of pethidine is 200 ml. Means 70 milligram order, right? Milligram. And here showing the volume is 200 ml and 200 ml contain 10 gram. So this is the gram, is the biggest unit, but I said all the time we have to use the same unit. So gram has to convert it to milligram. So this 10 gram multiplied by 1000, because 1 gram equal to 1000 milligram. So 10 gram equal to 10,000 milligram. So 70 divided by 10,000 multiply 200, because this is a volume. And this is a 1.4 milliliter. This is the medication we need for the patient. And here another some example and quiz for you. You have to practice when you have time. So like example, same formula you use when you do practice. They said the strength required divided by strength need, stroke need. So number of the tablet equal to this when need number of the tablet. But when need the injectable or volume, you use this formula. Strength, stroke, same like this. But you have to multiply the volume, liquid. But if there are no liquid, only tablet, you use this formula, right? So using this or this formula, we can calculate this 5. Example question here, it is very easy, you have to go. And here also keep this 5 formula solution, okay? So the patient order sulfide tablet, order is at 1200 milligram. The tablet came to your hand 400 milligram. How many tablet? Total tablet equal to order and medication in hand. Second question, a patient order this one 2.5 milligram, and the tablet came, the 5 milligram tablet came to the 5 milligram. How many tablet do you give to the patient? So patient order here is 2.5 milligram tablet. Order, this is an order tablet, means prescription medication, right? And also come to the 5 milligram tablet. How many? So tablet equal to dose, I've ordered dose, and also the medication, what the hand. And here the patient is experiencing the pain, ordered 25 milligram Toradol, is ketorolac for pain medication. The Toradol comes 30 milligram per ml volume. So 25, it is in hand, 30 multiplied by the volume. Another question, 2 years old child is ordered pain stop. This is a little bit complicated, okay? You have to practice. 120 milligram paracetamol by codeine phosphate 5. The doctor ordered 5 ml pain strip every 6 to 8 hours. How many ml dose do you administer? So if you use the same formula, the total, order divided by the strength in multiplied by the time, it will become the 5 ml. Same formula, but you have to take this number, okay, and 5 ml. So it would become 5 ml. So next here, a patient has returned from OT, operation theater, with a nausea and PRN. What does it mean, PRN? PRN means as needed. When patient need, we give it to them. As needed order is for ondansetron IM. Ondansetron medication we use for nausea. In order for the 6 milligram. So doctor ordered 6 milligram. Ondansetron comes 4 milligram by 2 ml solution in your hand. So 6 divided by the strength in hand 4 multiply the volume is 2 ml. It is 3 ml. Now go another. It is very important. You have to know medication formula by weight calculation. So milligram for each kilogram. So like I said, 5 milligram per kg body weight per kg. So if the patient weight is 25 milligram kg, so 5 times 25, So example, the child weight is 48 kg, the dose is 60 milligram each kg, but patient weight is 48 kg. So 48 multiply 16. So total the patient need this 768 milligram. So in NCLEX board exam, if they give something like this, like 10 or 16 milligram per kg, and patient body weight is 60 but 65 kg, you have to multiply always. So when you multiply, you have to able to calculate the total doses. So use the formula to complete how much you need. And now next one, example here. A 5-year-old girl is ordered paracetamol. The pharmacy guideline recommended 15 milligram per kg. So again, I said same meaning, but different way to express. So when we do the practice, we can read the examiner mind. So the child body weight is 80 kilogram and 50 kilogram per kg. So 80 multiplied by 15. So the total dose you need. It is total dose means doctor order. And the stroke is means medication in your hand 125 milligram per ml is volume. So how many milliliter will the child receive or need? First of all, I said we have to find out the total dose, that is the ordered. So strength is required 270, and the medication in hand or stroke in pharmacy 125 milligram multiply the volume is 5. So volume to be administered equal to 270 divided by this into volume is 10.8 milliliter total. And here another example for this type of mathematical problem. So a child weighing is 16 kg is ordered 40 milligram per kg per day. So you see 40 milligram per kg and my baby is 16 kg. So 40 in times or multiply 16. You have to get a number, and this number is total dose you need for the baby. So I mean, erythromycin. Find the strength for single dose. Means single dose per day, the 4 doses per day. So total dose divided by 4, we can count the per dose. So first of all, 16 years, body weight need how much? 40 multiply 16, 640 milligram per day. So how much you have to need for your baby? The strength required per day, number of doses per day. So total 640, and I have the medication. Okay, total this is total dose for whole day, but 4 doses 640. Single dose should be 640 divided by 4. We can get the single dose. If the question comes easy like this, just divided the total dose by 4. But always keep in mind, we have to convert, and conversion is the first formula. for calculation the mathematical problem. The medication formula for IV infusion. So we said the flow rate is usually flow rate ml per hour equal to volume divided by time. This volume is expressed in the unit milliliter and time is expressed by hour. This flow rate only usable or calculate if the time is mentioned in hour. If the time is mentioning by minute, we can use the defined formula. So go next. They said here, IV infusion calculation example, a patient is required 1000 ml fluid over 8 hours. Find the flow rate. We know the flow rate formula equal to volume per ml divided by time per hour. So 1000 divided by 8 hour means 125 ml per hour. This is the flow rate. And this one is the unit of flow rate, right? So 125 mLs per hour. This is the flow rate unit. This is the formula we used. And another formula here, this here they said a patient to receive 600 ml 5% dextrose in water IV2B infusion over 4 hours. So this 4 hour means time. And 600 ml, this is a volume. So this 5% dextrose just gave you to make you confusion. But you are smart enough, right? You do not want to put your foot in the trap. You're smart, right? So ml is the unit of the volume, and also the time is there by hour. Just calculate the flow rate, and flow rate unit is the ml per hour, right? So it is 600 divided by 4 is 150 ml per hour. We need the flow rate for patient. And here some example we left. Calculate the body weight and also the fluid administration. All of the 5 example, we have to use the flow rate equal to volume per time. If you use this volume per hour flow rate formula, you are able to calculate. But keep in mind, if anything body weight mentioning per kilogram, we have to convert it, right? So this example we left for you to calculate, okay? And here also the solution, like first one 500 milligram each single dose, second one 50 milligram. So same is answer is there, also there, okay? So very simple expression is we left here for you. So next here, so yeah, this little bit explanation and some example we left for you. You have to practice, okay? And here is also important, NCLEX board sometime give you some calculation math like this. You have to know these formulas.